Welcome everyone. This is Tetra Tech's live event webinar titled Insight into Coronavirus Aid, Keys to Understanding the Benefits and Limitations of Available Federal Funding. We will begin the broadcast shortly before 1:30 p.m. Eastern. If you have any questions, comments, or technical issues, please use the Q&A window to privately submit them. If you want to try out the Q&A window, feel free to test it out. Let us know that the audio is working fine, how things are where you are, or any other webinar technical issues. If you have any trouble with your audio, please check the volume on your local device. Sometimes you just need to boost the volume on your laptop or your PC. We will get started in about a minute. Good afternoon and welcome to everyone in attendance today. My name is Andy Mazzio. I will be moderating the third installment of Tetra Tech's COVID-19 live event webinar series. Today's topic is Insight into Coronavirus Aid, Keys to Understanding the Benefits and Limitations of Available Federal Funding. As we get started, you can send troubleshooting questions using the Q&A tab in the upper right-hand portion of your screen. Hopefully we address most of the technical questions early on through that tab. We also will collect questions you have about today's content. You can populate the Q&A tab throughout the presentation. We anticipate a lot of questions on this still evolving topic, so please remember to include your name and email so we can get back to you directly with answers to your questions. That said, I'm pleased to introduce our two speakers today. First, Chrissy Angeletti is a program manager and subject matter expert in the field of disaster management and environmental compliance. Her expertise includes FEMA public assistance, including 406 hazard mitigation and 428 under the HMA grant program for over 30 major disasters. She's currently providing subject matter expertise to clients throughout the nation for COVID-19 financial recovery projects. We also have with us John Burry, Tetra Tech's National Director of Post-Disaster Programs. Mr. Burry has 16 years of experience working with mitigation, emergency management planning, response, recovery operations, representing over $3 billion in disaster-related grants for over 46 major disaster declarations in 17 states, serving in the roles of subject matter expert, program manager, or principal in charge. So with that said, Chrissy, the floor is yours.
Great, thank you and good afternoon. Thank you for joining us. We know that there is a wide variety of people in the audience today, especially when it comes to the experience and available resources that you have to deal with the financial recovery aspects of responding to the COVID-19 pandemic. Some of you may experience a disaster declaration every year and have dedicated staff to handle your recovery, and then others may not have had a declaration in 10 years. Or you are completely new to this type of experience. So let us assure you, the response to this pandemic is definitely pushing us all into new territory. And I think it has never been more important for us to work with each other, share information as it becomes available, and form support networks that better prepare us for what's occurring now and then what is to come. So for today, John and I thought it would be best to present our top 5 of information you should know, questions you should be asking that will be crucial to your financial recovery. Then we hopefully will be taking a deeper dive into more specific programs over the next few months in some of our upcoming webinars. So for today, we're going to review some key points of 2 CFR 200, procurement requirements, general takeaways on major funding sources, how to structure your recovery program, the importance of document management, and finally, some good practices and online resources. So covering becoming familiar with 2 CFR 200. 2 CFR 200 establishes the uniform administrative requirements, cost principles, and audit requirements for federal awards to our non-federal entities. A federal award is generally a federal financial assistance that is something that a non-federal entity receives either directly from a federal awarding agency or indirectly from a pass-through entity. Typically, we find that financial staff of our non-federal entities are familiar with the procurement requirements of these regulations, which we'll touch on next. But we're often citing these regulations when we answer questions about eligibility and overall program implementation with other staff members and a lot of decision makers. So I'm presenting this slide because I really highly encourage you to spend just an hour and familiarize yourself with this section of the regulations if you've never looked there. If you come across an area that seems vague, there is a massive guidance and fact sheets, just a quick internet search away, trust me, especially from entities like FEMA on how these regulations have been applied and interpreted over the years. A key aspect to remember about 2 CFR 200 is that it is always the stricter of local, state, or federal regulations that will apply in these areas. So most often we're familiar with our local and state requirements, but the federal requirements can sometimes be stricter. And what happens is this often results in sort of a mixed or a blended approach to recovery. So for example, the federal micro purchase threshold is generally $3,000, which is often stricter than your state requirements. However, the women and minority owned business enterprise requirements, the WMBE, may be more stringent on the state level. So you end up with a blended approach applying the federal micro purchase requirements, but then applying the state requirements for WMBEs. These regulations are broken into 3 main sections. Again, I encourage you to just spend some time opening them up, going through them on the internet. And so what I'm going to give you are the following key points that we find in our practice are often overlooked. The first is going to be section 200-213, which prohibits the use of vendors or parties that are debarred or suspended. Just a quick practice tip here to ensure that you are registered under sam.gov. It's a free registration. Anytime you want to issue a contract, do a quick search of that vendor, find out their eligibility status, ensure they're eligible, and then print out those eligibility results and then just file that with your contract documentation. Most of the time there's not an issue, but the few times there is, you will be very glad that you did the search because you may have potentially prevented a deobligation of your funding. Next is section 200-321. This establishes that a non-federal entity must take all necessary affirmative steps to assure that WMBEs are used when possible. Look at this section. It goes on to define the steps and how and when firms should be solicited. It also talks about how to potentially divide up the performance responsibilities under a contract and the ability to pass these requirements onto a prime contractor in your RFP if they intend to use subs. Next is section 200-404, which defines reasonable costs. Print this section out. Put it on your computer, your bulletin board, use it as the quote in your email signature. Anytime you get into the crosshairs with an entity asking you to justify your costs, this is the litmus test. This section states that a cost is reasonable if in its nature and amount it does not exceed that which would be incurred by a prudent person under the circumstances prevailing at that time the decision was made to incur the cost. Then it goes on to give 5 factors to further determine the reasonableness of a given cost. The takeaway is this is not black and white. This is the gray area. So when I draft a letter to a funding entity, whether it's developing a project scope, a scope change, or an appeal letter, I cite this regulation. And then I go on to prove my points using the determining factors of this regulation. So when you're curious or concerned about the eligibility, go to this section, apply this litmus test to your current situation, and see if you can justify, underneath your expenditure under here. And honestly, this is why we're seeing a lot of guidance coming out from the awarding entities. This is going to help us establish what is considered, quote unquote, a reasonable activity or cost for this pandemic. If you're familiar with traditional natural disaster response and FEMA, there's a lot of sections that refer back to, yes, this is reasonable, or yes, this is an allowable cost. So again, this is a section 200.404. I can't emphasize it enough. This is the test you need to be looking towards. Otherwise, the chances are you could be putting your spending at risk. So really familiarize yourself with this section. Finally, the audit requirements. This is a big reminder that a non-federal entity that expends $750,000 or more during a fiscal year in federal awards must have a single or program-specific audit conducted for that fiscal year. So most of you that have expended funds like this, you've been through that process. However, if you expend less than that, you are not off the hook. You still have to keep these records available for review, for audit by the federal entity, the pass-through entity, or the Government Accountability Office, the GAO. Real world example. If you think this isn't a big deal, let me just go ahead and share with you a story from my first year working in this industry, where I witnessed firsthand a school district undergo an FBI investigation. It turns out the contractor they had been working with fled the state, and the corruption was so widespread through the school district, they were actually forced to fire their entire staff and then go through a district-wide rehiring. 3 of the staff were found guilty of conspiracy and sentenced to federal prison. I give this example because I really want you to think about when you are assigning these responsibilities. Sometimes with smaller government entities, we just throw this in the hands of the financial department, and we really leave it up to one person to go around and try to collect this documentation, and it's a heavy burden for them. And so really this goes beyond getting a check in the mail from the government. Acknowledging the fact that the people that are in charge of collecting and managing these funds are going to be under very heavy scrutiny. So I cannot stress how important it is to collectively support their efforts as an organization. And again, just turning back to just for an hour, go in, look at these requirements. They're going to be really helpful moving forward. Next up is procurement. So procurement in general is governed by 2 CFR 200. And again, you need to follow the stricter of the local, state, and federal regulations. What I want to talk about here is the emergency and exigency exception to procurement. So for most disasters, there's an early period when non-competitive procurement is allowed. We often refer to this as the emergency and exigency exception. And this exception occurs when the circumstances dictate that competitive procurement would cause such a delay that it would potentially exacerbate an emergency, or it's just not exigently feasible. And so while most of us are familiar with what constitutes an example of emergency, an imminent threat to health and safety, a potential example of exigency is when we find it with hospitals or schools. So let's say a disaster occurs in August and the school receives damages that would prevent its reopening in September, then you have an exigent circumstance where an additional 2 to 4 weeks to go through full procurement would potentially delay the opening of the school and would lead to additional costs that would not have been incurred but for the delay caused by the procurement. So that's exigency. 2 points I want to make under this exception is 1, the exception extends only to activities related to the disaster. If you cannot tie the contract or the work, the scope that you're doing back to COVID-19 emergency response work, it is most likely not going to be covered under this exception, and you would still need to go through full competitive procurement. So it's not a free-for-all. It still has to be related to the disaster. 2, the emergency period is typically a determined period of time. This is important because any work performed outside of that period by a contractor that was not competitively procured is going to be at risk. So oftentimes an entity, it's often the federal entity, will determine that the emergency period when that occurs. And there's typically a 30-day notice prior to the end of that period. However, I will tell you from experience that notice of when that period is ending is not heavily publicized often. So you need to be very proactive and be on alert for this date. When that announcement is made and you've got your 30 days, you need to give immediate notice to your contractors and vendors that were not competitively procured to stop work by the end of that period. So a lot of your contracts, you may have a 30-day notice. And if you haven't issued your contracts, maybe you don't want to have a 30-day notice, maybe you want to have a 10-day notice and shorten that time period, just if you're delayed in getting that notice, because again, anything done after that period ends may not be eligible. Also, during that 30-day period, you want to get prepared for full procurement. That way, by the time the period ends, you hopefully have a new contractor lined up to start work, and that's going to avoid any gap in your services. Thirdly, all contracts, regardless of procurement methodology, have to include the federal contract clauses found in Appendix 2 of 2 CFR 200. So again, go back to 2 CFR 200, print out Appendix 2, throw that onto your contracts. Under the emergency exemption, you are allowed to use existing contracts or sole solicit. However, if you are using an existing contract, you must modify those contracts to include the federal contract clauses located in Appendix 2. Finally, any purchase made under this exception must be documented as to why you are using the exemption. So we're seeing this a lot with the PPE that's been recently purchased at a much higher market rate for COVID-19 response. And federal entities are coming back and requiring written documentation of why the PPE was purchased at a higher rate. So for example, this could be an explanation that costs are higher due to the nature of the emergency and limited supply of the PPE at that time. There needs to be some tieback. So, and also there needs to still be a reasonableness aspect to this justification, which means you need to establish some internal controls early. So maybe this is an internal threshold that you establish, and saying that you're going to avoid any purchases higher than a 15% markup. Based on our knowledge of previous audit findings, typically anything above 15 to 20% markup is generally going to be at risk. Again, this documentation just really needs to be kept in your records. It needs to be written. So this includes any determinations from your local health authority. This is going to tell you eligible activities and potentially justify eligible individuals. Your council or board resolutions and meeting notes, especially when discussing agreements and contracts. Your mutual aid agreements, there's a lot of guidance on there about how those should be structured and including your pricing in those agreements. If you don't have one already, please develop a standardized template for your departments for any emergency purchase that requires them to complete a justification section for that purchase that directly ties back to those response efforts. So in short, somewhere in your files, FEMA is going to, or the federal entity, HUD, whoever it is going to ask for a written explanation that justifies the purchase as it relates to the pandemic. And if you want that to be eligible for funding under this exemption, you need to have that documentation available to be provided. Next up, this is our discussion of just sort of three major funding sources. Typically, our government entities are familiar with the use of FEMA public assistance and HUD's community development block grant funding. We now have new funding sources under the Coronavirus Aid, Relief, and Economic Securities Act, the CARES Act, and the announcement of CDBG-CV. So as you can see from the slide, we have adopted the phrase building the plane while flying to describe our feelings on how these funding sources are going to support recovery efforts. We are seeing new guidance come out almost daily Just recently, there was a press release from the White House indicating that CARES Act funding could now be potentially used as match funding for public assistance. Great news, huge news. However, there has been no official guidance on this yet from the Department of Treasury. So this leads us back to, you may have already seen that lovely little FEMA page that's been set up on their site that says, quote unquote, rumor control. From our perspective, the safest way to guarantee your funding is to wait for official guidance from the distributing entity and have that in writing, whether that's in the form of an FAQ or in an individualized official determination letter. So for us, we would not advise our clients that this funding is available for match until we saw that officially in writing from the Department of Treasury. So in general, what are the questions we should be asking under each of these programs? And they really boil down to a few key topics. 1, who is eligible? 2, what is an eligible activity or cost? 3, what time period does this funding cover? Because it's different under each one. 4, what is the cost share or the non-federal entity's financial burden? And finally, what is the level of oversight or administration of that funding? And when you have answers to these questions, you can begin to develop your funding strategy that John will talk about next, the risks associated with your expenditure, and the types of documentation and record keeping you should be managing. So for FEMA, if you've gone through a recent disaster, you may be familiar with FEMA's online grants portal. However, for this disaster, FEMA has developed a streamlined process, hence the unofficial analogy of autopilot. Under this process, they're asking entities to go into grants portal and start the submission process. Typically, you would be assigned a FEMA representative who would operate as your main point of contact, and you would have an exploratory call or some type of kickoff. However, under this disaster, FEMA has recommended that you not wait for a representative to be assigned, and in some cases, a representative may never be assigned. So some people have asked, if I register, am I obligated to take the FEMA funding? And the answer is no. Unless you are requesting some sort of advancement of funds or some type of expedited funding, this is a reimbursement-based program. At a minimum, we really recommend that you register and get your place in line, just as a form of just in case. I've seen a number of cases where someone wasn't registered and then they missed the deadline to apply. And they try to apply later in the day, and FEMA comes back and raises the point, hey, you had the chance to request funding, you didn't, why are you doing it now? That often throws them into a higher level of scrutiny, and we really don't want you to fall into that camp. So if you haven't registered, go in, even if you don't have, you've got $5 of cost, just go ahead and get yourself registered in grants portal. Also, FEMA is aware of the CARES Act funding, very heavily aware. and just so you know, part of this process is going to be working through your funding and where it's being spent and what funding is being spent where. And that will be worked out, of course, over the next year. As you all know, the CARES Act funding is a new source of funding that's being distributed in various ways. And so we just dubbed this one as assembling the flight crew, because the oversight of this funding and the administration of how to CFR 200 will be applied and implemented is still being structured. And so while we're seeing a lot of guidance coming out on eligible activities, there isn't that organizational capacity under the Department of Treasury like you have with FEMA or HUD, which leaves a lot of questions on who should I be reporting to, what are the standards I should be applying, and a lot of this guidance may come in the upcoming months. So the question is, what can you do in the interim? There's really no harm in looking at some of the well-established guidance under existing frameworks, just as a guidepost. So you may say to someone, hey, we know this is an issue under public assistance. And they'll say, yeah, but this is a different funding, so different rules apply, right? And the answer is possibly, but they can't really be that different. I mean, this is where you want to return to 2 CFR 200 because we know these regulations will be applied at the end of the day. Finally, we have the new funding under CDBG-CV. This is essentially the requirement for the CARES Act funding as it's going to be distributed through the CDBG grants. HUD is drafting the federal notice now, which includes waivers for CDBG-CV, fiscal year 19 and 20 CDBG allocations. They are encouraging that before the Federal Register comes out right now, CDBG grantees go ahead, amend or prepare your annual action plans as soon as possible. Don't wait for the Federal Register notice to come out, and amend your public participation sections, especially to provide for remote participation. We call this one beverage service because, we know it's not available now, but we know that it's coming, and we're always glad when it does. Because under limited circumstances, it can be used as match funding for FEMA PA. We joke the drinks aren't always free though, so you'll most likely have to show a tieback to the event, and to be eligible, the activity may still need to meet one of the national objectives, which could potentially increase the type of documentation you're required to have on record. All right, with that, I'm going to turn the presentation over to John, who will provide suggestions on structuring your recovery program, the importance of document management, and finally, some good practices as they relate to financial recovery.
Thanks, Chrissy. All right, so when you're looking at defining these programs, if you could click on the bullets there, Christy, please. One of the things that we really look at doing is conducting the needs assessment within your community, because these grants are so interconnected and there are so many ways to develop them. We're seeing a lot of communities reach out, not only within their departments, but within nonprofit organizations or within other groups within the community to better understand the impacts of COVID-19 so that they can define and tailor programs to meet those needs. Of course, the next is policies and procedures, understanding the documentation requirements, and with a broad guidance document like the CARES Act has, with CRF, the CARES Relief Fund has, that it is extremely important to develop those based on perhaps existing programs. And then we're seeing a lot of communities create that spend plan or your action plan. I know that's thrown around a lot in HUD terms, but creating that spend plan and understanding what those big buckets are within your organization, I think, are extremely valuable, and you'll be able to fall back on, because things may change. Certainly, when it comes to things like the CRF, you may be looking at a potential of changes in eligibility. I know a lot of governors, a lot of local governments are looking at the issue of utilizing the CRF for revenue losses, and that may dramatically impact your way you spend your money. What we're seeing a lot of communities do is establish certain programs that are focused at the community level, whether that is rental assistance, mortgage assistance, or small business assistance. There are many communities out there that are doing that now with some of the HUD funds and are awaiting that future guidance relative to the CRF as well as FEMA. Again, and that kind of leads to the fourth point, which is your ability to review and adjust those priorities and adjust those programs. I think this is going to be a living, breathing document. That's really what we're seeing out there. This is unlike, as Chrissy mentioned, unlike many of the disasters that we've seen before, where you have the interplay within the federal agencies and the priorities are changing. Whereas, initially it was a very large focus on non-congregate sheltering. Now it's on something like contact tracing that communities are looking at spending their money on. So again, one of the things we're seeing is establish, as a best practice, to establish a COVID-19 recovery committee, a blue ribbon committee, a steering committee, something along those lines, where you may have subcommittees looking at public health issues, economic issues, as well as infrastructure. Creating an internal and integrating that internal and external stakeholders, and of course, obtaining that support from elected officials. So that, again, we're really encouraging communities to define those programs. And of course, finally, document management. How critical it is. I mean, you hear the three most important things when it comes to these disaster grants are document, 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 and the need for early departmental coordination is key. Involving the finance department, involving your key stakeholders to provide training, provide awareness of everything from timesheets to contracts to procurements. All of those things are going to be necessary because the next piece is something that we're really awaiting to see, seeing as how it evolves, this issue of duplication of benefits. Again, because a lot of these grants cover the same thing, CDC, FEMA, HHS, as well as HUD and CRF are your ability to play. That's something that I think is rapidly involvement. But what I can tell you is that level of documentation is going to be key. And I don't think that there's any, not too much documentation is a bad thing. And then, of course, monitoring those risks, testing your controls, and reporting your compliance on how you are performing. So, again, one of the things we're seeing is, as a best practice, is assigning and empowering that owner, assigning a project manager or program manager to the CARES funds or to these or to the FEMA funds. One of the other things we're saying is to not wait to get the data. Certainly, going out and being proactive. Reaching forward, leaning forward to get that data. And again, what we're seeing is, and what we're saying is 80% of your effort should be on that documentation and what those processes, procedures are related to that. So next slide, please. So things that you can step away with right now, if you could go back, yep. The actions for right now, I think it's really important. We're seeing a lot of communities forming a network. Again, you hear the phrase, we're all in this together. It's truly the case. So a lot of finance departments are talking to each other, those who are direct allocatees of the CRF or hospital districts, medical districts, coming together to better understand these, reaching out to the state as the grantee for the FEMA funds, as well as State Department of Health, and then memorializing those communications, understanding, get that in writing, how critical that is. Final slide here. Those are some online resources that are available. Certainly, you can write those down later. And with that, I think we'll turn it back over to you, Andy.
Thank you, John. And thanks to both you and Chrissy for your thoughts today. For attendees, please remember this. This and previous COVID-19 webinars can be found at the link here, Tetra Tech's website. Our next webinar will be held on Wednesday, June 3rd, beginning at 1:30 p.m. The topic will be using the dip in the pandemic curve to conduct a COVID-19 after action review. As registered attendees for today's webinar, you will automatically receive an invitation to our future webinars. Thank you again to all for attending today's event, and we'll talk again soon. Bye now.